It's a COVID test that you can take at home, and it's coming soon to your local drugstore in a couple of months or so. But can you really rely on these tests? Well, the I-Team's Carolyn Johnson wanted to find out just how accurate they are.
Mark Lemus has been tested for COVID twice after possible exposure to the virus. Both tests were negative.
We just wanted that peace of mind of having done the test and seeing what the results are.
But the PCR tests were time-consuming and pricey. He waited in line for 6 hours for one test and paid $130 for the other. But soon, home tests will change this. The FDA has fast-tracked the approval of 3 at-home tests that promise results in as little as 15 minutes. The cost ranging from $5 to $50. One does require a doctor's prescription, but another you'll be able to buy straight off store shelves.
I think that the more availability of testing that there is, the better we all are.
Professor of Epidemiology Anne Ramoyne at UCLA's School of Public Health says professional PCR testing is the preferred method. But if that's not doable, home tests are a great option. But she has some advice. Home tests will likely use nasal swabs. Professor Ramoyne says it's ideal if a healthcare professional can watch you collect the sample, even if that's done virtually.
Making sure that you do it correctly is going to be key, and user error is always going to be a factor here.
And even with a good sample, Professor Ramoyne says COVID tests aren't always accurate. 2 of the at-home versions are antigen tests, which the CDC says can fail to detect the virus when you're not showing symptoms. The 3rd test you'll be able to take at home is called a LAMP test, which can be more reliable. According to the FDA, these home tests have an error rate of about 10%. And Professor Ramoyne warns while a negative result may be encouraging, it is not a free pass.
We also have to remember that that test is only valid for that moment that you took that sample, because you could be exposed afterwards, or you could be in an incubation process.
As for Mark, he is eager for the home tests to hit the market, although he says his life will still remain quiet.
We have just been staying home. We only go out for groceries or food, really.
And that's exactly what Professor Ramoyne suggests we all do.
Testing is no substitute for all of the things that we always talk about in terms of public health and prevention, which is wearing a mask, social distancing, hand hygiene, avoiding congregating with people outside your own household.
As she points out, with infection rates so high right now, we all need to take even more safety precautions now than we did just a month ago. For the I-Team, I'm Carolyn Johnson.